Fortunately, a child has died from measles in West Texas. It was one of the 18 children who were hospitalized with measles out of the 124 cases of measles in West Texas. I'm Dr. Simpson. If you want to keep up to date with this information, give me a follow. Currently, of the 18 children who are there, we are hopeful that the remaining will survive, but there's always a chance that they won't. Measles is running rampant through West Texas because measles is one of the most contagious viruses out there. Let me give you an example. If you are standing in a place where a person who had measles was 2 hours before and you have not been vaccinated, you can get measles. This is why we are exceedingly concerned about people who have a lower vaccination rate, like the people in West Texas. So who should be vaccinated? If you were born prior to 1957, you had measles as a child, chances are you probably need to get a vaccine. Please talk about that with your doctor. The early vaccines which were done, 1967 and before, were not terribly effective, and oftentimes we recommend those individuals get a vaccine. I was revaccinated even though I had measles as a child because I was going to an area in the Philippines which had a lot of measles in it, and I certainly didn't want to bring it back to the United States. If the best protection against measles is the MMR vaccine, if you've had 2 doses, you're going to be fine. Now, the problem is that one of the individuals who came down with measles traveled to San Antonio and had several stops along the way. We are anticipating seeing more measles because in areas where there is a low vaccination rate, measles will find its hold and measles will continue to grow. The best thing you can do for you and your children is to get vaccinated if you haven't been. That's the best we can do. In terms of those who make the outrageous statement that this came across the border from immigrants, it didn't. The activity is very clear. This came from United States citizens who went overseas in areas that was endemic with measles and brought the measles back with them. They weren't vaccinated, their kids weren't vaccinated, and unfortunately, children are always the ones who suffer from this. Here's some more bad things that can happen to kids who develop measles. About 1 in 2,000 of them will develop a measles encephalopathy and be left with permanent disability from blindness to discoordination to cognitive decline. About 1 in 2,000 children who develop measles can get an accelerated form of what appears to be multiple sclerosis, where they demyelinate their nerve fibers and develop paralysis, etc. And finally, children who get measles, all children who get measles, develop an immune deficiency for the next 2 years after measles, making them far more susceptible to other diseases like COVID or pneumonia or influenza. Measles is not a benign disease. In spite of you having fond memories of what you were like when you were a kid and going to measles parties, that was just silly. Measles is a deadly disease, and it is here and it is making an imprint. Please get vaccinated if you haven't been. Please get your children vaccinated if you haven't been. That's the best thing you can do to prevent the devastation.